Okay, seeing as it's 2:01, I'm going to get started. So a few of you might know me from past sessions. My name's Shruti, and today I'll be going through how to revise for the UCAT, what the UCAT is, and just taking you through each of the sections and how to answer questions in each of the sections and give you some of my top tips. Again, a little bit about SIXMed for people who are just attending this session for the first time. It's a company which was created by medical students for other medical students, and over the past 6 years we've taught around 10,000 students in total. And the kind of events we run are SIXMed surgery webinars, which is what I'm doing today, and we run those every Sunday. We also offer UCAT and BMAT support, so if I minimize that. On the right hand corner you can see what sort of support we offer. So personal statements, UCAT, BMAT, and interview support. So interview support includes one-to-one tuition, or you can attend mock interviews, which will be like a whole day of MMIs, or interviews where you get to practice different interview questions and also get feedback as well. So that's the kind of things SIXMed does. So a little bit about me. I'm a 4th year Bristol medical student. I'm currently doing a research year, so I'm intercalating in London. And I've always been really passionate about teaching, which is why I get involved in these kinds of events. And currently I'm interested in surgery. So looking at the agenda for today, first of all, I'll take you through what the UCAT actually is, and then we'll go on to talk. Sorry, just one second. Hopefully everyone can see the laser pointer, which might be a little bit easier. So first I'll be just introducing you to what the UCAT is and key dates and relevant UCAT admin. And then we'll look at different UCAT sections and go through some practice questions on how to answer different questions. And I'll go through my top tips, and then we can have a Q&A session if you guys want to ask me any questions about anything UCAT related or anything medical admissions related in general. So just a bit of housekeeping, just make sure you're muted. I think all of you are, but just make sure you remain muted for the whole session, so there are no disruptions. I try to make these sort of PowerPoints really interactive as possible, so I'll ask lots of questions, and feel free to type your answers into the chat box, and we can discuss them. Also use the chat box to ask questions as we go along through the slides. I'll try to answer them with each slide, or I'll save all the questions right to the end for our Q&A session. Okay, so first question, on a scale of 1 to 4, how confident are you feeling about revising for the UCAT? So you can just type in numbers 1, 2, 3, or 4. Okay, most people saying 1s, 2s, or 3s. There's a mixture of people. Okay, perfect. So that's what I wanted to see. I was hoping most of you would be 1 or 2, so then we can go through this session, and hopefully by the end you'll be at a 3 or a 4 in terms of how you're feeling about the UCAT. So what this session aims to do is to try and help you learn what the UCAT actually is, and also to teach you how to approach different UCAT questions and give you a little bit of an overview of what you need to be revising for during the summer and how you can revise best. So first of all, what is the UCAT? So it's known as the University Clinical Aptitude Test. Some people might remember it as being called the UKCAT. It's the same thing. It's essentially a medical admissions test, and lots of universities use it for medicine as well as dentistry applicants, and it's a way of assessing your aptitude, and it's another component to your medical school application process, and they score you on it, and based on that they determine who gets an interview, or if you're offered an interview and you're being considered for a place at the medical school compared to another student, they might take into account your UCAT score as well. But different universities use your UCAT scores in different ways. So it's important to check their website in terms of how much weighting they place on the UCAT score. It's a computer-based multiple choice question exam, and there's lots of different sections. And some of you who have done your driving tests, your driving theory test, may have done it at a certain test centre. So similarly, UCAT is also done at a Pearson VUE test centre, similar to the driving theory test. So you book a test through that the UCAT website, and then it will be done at this Pearson VUE test centre, whichever is closest to you. If you're applying for 2023 entry, which is most of you, based on the comments that you said earlier, or if you're applying for a deferred entry for 2024, you would be sitting the UCAT this year, August to October time. So the main things to know about the UCAT, there is a fee to sit the exam, so it's £70 to sit the exam. For people who, are struggling in terms of their financial situation, you also can apply for a bursary to cover that exam fee, and it's also slightly cheaper for those people, but have a look on the UCAT website again. You need to remember that you can only have one attempt per academic cycle. So what I mean by that is, if you're writing the UCAT this summer and you don't do as well in the UCAT, you cannot retake the exam again this summer. You'll have to wait for the next academic year before you can take it, if that makes sense. So you only get one attempt. After your exam finishes in that Pearson Test Review Centre, you get your results immediately. And they're given a piece of paper with the breakdown for each section, what mark you got, and then your overall mark as well at the bottom. And then finally, different universities, as I said before, will use the scores differently to allocate interviews or offers. So have a look at the specific university that you're applying for, have a look at their website to see how much weighting they put on the UCAT scores. So these are the list of universities which require you to write the UCAT exam as opposed to the BMAT. So as you can see, almost all of the UK medical schools use UCAT. There's only a select few like Oxford, Cambridge, and UCL and Imperial, which require the BMAT. So just make sure you write the UCAT or the BMAT depending on which universities you want to go to. But I'm not going to be talking too much about the BMAT in this session, because another colleague will be covering that in a few weeks' time. Okay. So moving on to the section specifically, within the UCAT exam, as many of you might already know, we have 5 sections. So the first one being verbal reasoning, and followed by decision making, then quantitative reasoning, abstract reasoning, and situational judgment. And it's really, really important to understand the time, how much time you get for each of these sections and how many questions you get, because that will determine how long you should be spending per question, as I've shown on this table. So for verbal reasoning, a lot of people find this the hardest section, but I'll go through some questions with you guys to try and help you and give you some tips. You'll get long passages, and you'll get 4 questions per passage, and you'll be asked to sort of make conclusions from those long passages. So you have 44 questions in total, and you have to complete those questions within 21 minutes, so approximately 28 seconds. So you don't actually have that much time to look at such a long passage, but I'll give you some tips on how to approach those questions best. Following this, you have a decision-making section. So this would be, they give you different problems, and it's sort of a problem-solving tasks. So in total, you get 29 questions, and you've got 31 minutes. So this is probably the section where you have the most time per question. So you have just over 60 seconds per question. For quantitative reasoning, so that's your maths, so things like fractions, percentages, they may ask you to work out, how much drug is in a solution, things like that. And you've got a total of 36 questions to complete within 24 minutes. So again, you're limited in terms of the amount of time you have per question. So the thing to suggest for quantitative reasoning is practicing your mental maths when you're revising, and trying to learn to convert, percentages and fractions and things like that in your head, and conversion of units and things like that. Just make sure you're able to do that in your head really quickly. So that comes with more and more practice. You do get a calculator on the computer to use, but just to save time, try to avoid using that and practicing on your mental maths, so you're much faster and you have more time if you do want to spend it on some more difficult questions. Then you have abstract reasoning. So this is where you get lots of different shapes or sequences of shapes, and you need to find the next sequence. So I'll go through what that means later on when I talk about that specific section. So this is probably the section where you have the least amount of time per question. So you get 55 questions and you only get 13 minutes to do it in. So per question, you only have 15 seconds. So again, with more and more practice, you'll be able to recognize patterns and sequences faster. Finally, you have situational judgment. A lot of people find this the easiest or relatively easy compared to the other sections. So you get 69 questions within 26 minutes, so 23 seconds on average per question, and you get different medical scenarios or ethical scenarios. And they ask you to rank what's the most appropriate thing to do, or what's the least appropriate thing to do. So those are the kind of questions you get. So before I go on to the specific sections, just talking a little bit about how scoring works for the UCAT. So verbal reasoning, decision-making, quantitative reasoning, and abstract reasoning are known as the cognitive subtests. So those 4 sections, each of them will be scored between 300, which is the lowest mark you can get, to 900 for each section. And the marks for each of these sections will be combined to get your overall score, which is between 1200 and 3600. Then you have your non-cognitive subtest, which is your final section, the situational judgment. And marks for the situational judgment are expressed slightly differently. So they're banded as into band 1, band 2, band 3, and band 4. Band 1 is the highest, band 4 is the lowest. Most students tend to score between band 1 and 2 because it's mostly common sense questions. And usually students who are likely to get interview offers are people who score between band 1 and 2. Band 3 and 4, it's very, very difficult to score band 3 or 4 because, as I said, most of these questions are common sense based. And if you revise your ethical principles and look at and read and do lots of practice questions with situational judgment, it's pretty easy to score band 2 particularly. Okay, just as an idea of what previous students have found the hardest, these were the average scores last year. So as you can see here, the lowest scoring, or the section that people find the hardest, is verbal reasoning. So 572 was the average score, followed by decision making. And that's probably, especially for verbal reasoning, it's probably because of those long passages and not having enough time to extract the information, or not interpreting the question or statement they ask you in the right way. But again, the more practice you do, the better you get at verbal reasoning. And then the highest scoring is usually quantitative reasoning, which is the trend has been the same in previous years as well. And situational judgment, most students tend to score band 2. I've written at the bottom here, 620, scoring about 620 on average per section is considered pretty good. So that should be your mark sort of to go off of. Just before I move on to timelines, let's see, there's something in the chat. What score did I get? So it's been a while since I've done it. I can't exactly remember, but I got an average of, I would say, moving back to the previous slide. So for situational judgment, I got band 2. And for all of these sections combined, I think I got between 610 to 620. And the only thing that I didn't do as well on was the abstract reasoning, which was slightly lower than expected. But I can't remember my overall score. But that was approximately what how I did. So moving on to timeline. So 24th of May, which is in 2 weeks' time, at 9:30 a.m. You can create an account on the UCAT website, and anyone who requires a bursary or requires any access arrangement can apply for that. Those applications open on the same day. Then a month later, on the 20th of June, you can start booking when you want to do your UCAT. You do have sort of 6 weeks before when you book your test to be able, I think it's 4 to 6 weeks, I can't remember exactly, so definitely check on the website You can move your exam date. So if you don't feel as ready, you can move it to a later date within 4 weeks period or something like that. So definitely consider that if you feel you're not ready yet as well. 11th of July is when the first UCAT tests start, and they run all the way up until the 29th of September. On the 20th of September is when you have the access arrangement deadline, and 22nd of September is the last day which you can book your UCAT test. And as I said, 29th of September is the final day you can do the UCAT. And then just for people who are thinking of applying for a bursary, those application deadline is on the 30th of September. And as we know, UCAS deadline's on the 15th of October. So all of your medical admissions details and stuff will have gone through to your universities on that date. And within early November, the results, your UCAT results should go directly to the universities. So you don't need to do anything. You do get a copy of your own results, but your results also get sent directly to the uni, so you don't need to directly contact them. Okay, so let's move on to the specific sections. Before I do that, I've got 2 questions in the chat, so I will just, when are the deciles allocated? So I'm not sure when the deciles are allocated, but also you have to remember it's not about the national deciles, it's about how each university puts weight on the UCAT. So how much of your medical application, how many of those marks are going towards the UCAT compared to your personal statement, etc. So that you can only find that out through the specific, if you're going to, for example, University of Nottingham, you will have to look at their website and see how much weight they place on the UCAT in terms of scoring medical school applications. I think deciles will be allocated, I'm assuming November time, when they get the information from the entire national cohort. So hopefully that was useful. Someone else says, doesn't matter if you do the test earlier or later. No, I would say do the test when you feel ready and when you feel like you've had enough time to practice each of those sections, and you feel like it will be the best time for you to do it. Sometimes people book their test really, really late, and then actually they get really anxious that they're having to wait. So I'd say you can move your test earlier if you wanted to. Again, people who book their test and they feel like they haven't had enough time to revise, they can also move their test. So be a bit flexible with it and try and think about how your own learning style and see if you've had enough time to prepare for everything. So it's really up to you. It doesn't matter whether you do the test earlier or not, to be honest. Okay. So let's talk about the specific sections. I'll start with verbal reasoning, which is the one that people may find the hardest. And this is your first section that you start with. I'd say don't be discouraged if you feel like the verbal reasoning section didn't go well, because for a lot of people, because there's so much text on the screen and so many passages to get through, it can feel like, oh God, I've started this exam and it already feels like I'm doing badly. Try and take away the sense of I have to go through loads of passages and just work through it in a structured manner, which I'll teach you how to do. So as I said before, you have 44 questions to do in 21 minutes. And you get 11 passages in total, and for each passage you have 4 questions, so in total 44 questions. The structure of questions, they can be most suitable questions, so you get given a statement and then you have to say what the most suitable answer is, so match the statement to the answer. Or you get true, false, can't tell questions. So I'll go through one of these in a minute. So looking at this question, I'll just work through it with you guys. So the question's asking you which of the following statements are true, false, and cannot tell, and I've just picked one statement. So the statement they've given you is university students need to undertake a summer internship or work experience in order to be offered a full-time job. Is this statement true, false, or cannot tell? Now, looking at it, if you get a passage like this, even I would be really overwhelmed because there's so much text to cover for just one statement. But does anyone have any idea of how to approach this question? What do you think you would start by doing? If you could type it in the chat. Cool. A few people. So someone said scan the text for keywords. A few people are saying read the question. A few people are saying read the text. Okay, So a mixture of different things. I like the people who've suggested looking for keywords in the text, looking for keywords, but and I really like someone's answer where they've said scan the text for keywords from the question. Perfect. So that's how I'd approach it. First thing I would do, as I did, is read what the statement is and what they're asking you to do. So they're asking you to find whether it's true, false, or cannot tell. And then what I would do is highlight the keywords. So my keywords would be university students, summer internship, work experience, and this statement, this phrase, offered a full-time job. So what this statement is saying is that university students will only be, to be offered a full-time job, they have to take summer internship or work experience. So that's how I interpret it. So now we need to see, is the statement true based on the text? Is it false, or can we not tell from the text? And then, as some people have already said, look for those keywords. So the first sentence says work experience and internships are considered extremely important for university students looking for graduate jobs. So they're saying it's important, but they're not saying that it's necessary, that only if you do these two things will you be offered a full-time job. So from that first statement, I can't really, say that this statement is true. Then scanning for more of these keywords. On the third paragraph, I find the companies that run these internships often take several students at a time and may end up offering them permanent full-time work at the end of the summer. So the keyword here is may end up offering, whereas this statement is saying in order to be offered a full-time job, they need to undertake summer internships or work experience. So because it's may end up rather than will end up, I would say the statement is false. Does that sort of make sense to everyone? Let me know if you didn't understand any of the sections, and I can go through the question again if you want to. If someone could just say yes, you understood it, or no, I need a little bit more help. Perfect, yeah. You do have to be quite critical and very, very careful, as I said, with the wording. This is why a lot of students slip up with verbal reasoning questions because they interpret the statements slightly differently. So the more questions you do, the better. And I'm not just going through loads of verbal reasoning questions isn't going to help you get better. You need to, of the verbal reasoning questions you've done, the ones you've got wrong, clearly and carefully read why you've got it wrong and why it was a different answer, so that you can try to understand how they've interpreted the statement. Okay, so to save time, I would, as I said, pick up keywords, scan for those keywords in the text, and then interpret and answer the question. Okay, so the answer was false. Next tip, so read the question first, search for your answers, lots of you have said. Keep practicing, don't overthink or hesitate, especially the first answer you put down is an answer based on instinct and it tends to be right about 90% of the time. Don't go back and hesitate on your answer. Learn to scan through the text effectively. Again, this will come with doing lots of practice, especially online stuff. So there are lots of UCAT textbooks where you can practice, writing the answers down on pieces of paper and stuff. But I would say practice on the computer because it's completely different to a written exam versus a computer-based exam. So practice under timed conditions on a computer. And if you're unsure about a question, remember to flag that question, move on to the next one and come back to it later when you have some time left at the end of that section. But before you flag and move on, make sure you put down some answer. So even if you run out of time, you will have still put an answer on that question and you have a 1 in 4 chance of it being right, if that makes sense. Okay, moving on to decision making. We have 29 questions in 31 minutes. You can get lots of different types of questions here. So you can get graphs and then they expect you to draw conclusions from it or, give you different problem solving questions. They can also give you drag and drop questions. So I'll go through what drag and drop questions are in a minute. Or they can give you simple calculation questions like percentages, fractions and things like that. So example of a drag and drop question is this. So this question passage is saying, all of my jumpers are blue. So let's label this person as person 1, and then this is person 2. Some of your jumpers are red, but none are yellow. the jumper that they're talking about is either yours or mine. So it's either person two's or person one's. So it's a little bit confusing, the statements, but just highlight the main texts, and you should be okay in terms of answering yes or no to each of these statements. And then it's saying answer yes if the conclusion follows and no if it doesn't. So the first statement is the jumper is yellow. So does anyone, is anyone willing to answer this? So will this be a yes or a no? Let's have a look. Okay, most people saying no, yeah, perfect, because we know from this text that none of the jumpers are yellow, so this jumper cannot be yellow. So this is a no, perfect. Next statement, the jumper is red. Would you put yes or no for this? Okay, some people saying no, some people saying yes. Okay, let's have a look. So some of the jumpers are red. This jumper is either yours or mine. So because the jumper can either be person one's or person two, and some of person two's jumpers are red, then I would say the jumper is red could possibly be true. So it would be a yes, if that makes sense. Then the third statement, C, is saying, if the jumper is mine, it's blue. Do you think that's a yes or a no? What are most people saying? Yes, perfect, because we know that all of person one's jumpers are blue. Perfect. Okay, D, if the jumper is yours, it's red. Is that yes or no? Now this is a bit of a tricky one, so think about it carefully. Some people saying yes, some people saying no, okay. So if the jumper is yours, it's red is a very, very factual statement, but we know that person two's jumpers, only some of them are red, and others could be other different colors. So actually, statement D is a no. So we don't know, because this statement is basically assuming that all of person two's jumpers are red, whereas from the text, we know that that's not the case. So D would be no. And E, if the jumper is not mine, it's red. Is this a yes or no? What do you guys think? No, perfect. Yeah, that's also good. So you can see that these questions, you really need to think and to sort of critically and use your critical thinking skills, and that's what decision making really tests. And these are the types of questions you can get, but it's really important to, you get a whiteboard as part of your exam, and you can just make little notes and put person one, person two, put the colors down so that you can work it out in your head easier. But remember, you do get the most amount of time for the decision-making section, so please don't panic if you're finding these sorts of questions a little bit harder than other sections. Again, with more practice, it gets easier. So main tips for decision-making: write down the key information that you get on the whiteboard that's given. Don't skim over information. You can skim over information in verbal reasoning and you might be able to get away with it, but with decision making, I wouldn't advise that, because, you know, these kinds of statements, it's really important to get your answers right. And again, practicing, and if you find something difficult, flag, move on and come back to things later. Okay, moving on to quantitative reasoning. So quantitative reasoning is relatively easy. So it's GCSE level maths basically, and you get 36 questions in 24 minutes, lots of maths problems. You do get an online calculator on the right hand corner of your screen if you need it, especially for difficult sort of calculations that you might want to do. The main tips for this is just practicing your mental maths and use your calculator when needed, and again practice lots of questions. And the one thing that I noticed even I used to do when I was studying for the UCAT is, if I flagged a question because I found I'm spending too much time on it and I'm not actually getting to the answer and I need to move on to the next question, sometimes I'll end up constantly thinking about that problem that I've already flagged rather than focusing on the next question that's right in front of me, and that can lead to time wasting, and that means that you might not concentrate on this question or get it wrong. So remember to avoid thinking about, you know, past questions that you said you're going to come back to later, and just focus on what's in front of you on the screen. And that, I think that goes for every other section as well. If you're struggling with a certain question, try to avoid thinking about it and come back to it later at the end. Okay, a few questions here. Do you only say yes if the conclusion is definitely true? Yes. So for decision making, yeah, you do. I will get back to some of the questions at the end so that I can, oh, I didn't get B. Could you explain that one? Was this, I'm guessing this is for decision making. Let me actually go back to that quickly because I think it's an easy one to explain. So the jumper is red. So that's a very factual statement again. And it says that the jumper that they're talking about is either person ones or person twos. So the jumper could be red. So in that case, I would say the answer is yes. Does that make sense? Because it could be person Bs. And I think that was you who asked that question. Someone else has said, can you flag a question even if you've guessed it? Yes, you can, because you can always come back to it later on, if that makes sense. Let's move on. So abstract reasoning. You get 55 questions to do in 14 minutes. So this is the one which you have the least time in. And you basically need to identify patterns within a set of different shapes and predict the next sequence. So they'll give you something like, this is set A and this is set B. And then they'll give you, and then the test shape on the right-hand corner, that's your, those are the three ones you're looking at. And you're trying to see if these test shapes 1, 2, and 3 fit into the sequence of set A, or if they fit into the sequence of set B. So you need to find what's the common sequence in set A, what's the common sequence in set B, and whether this one fits into set A or B. And same with number 2, A or B, and 3, A or B again. So the types of questions you can get is, like I said, you can get given set A or set B, and the question will ask you which set the test shapes 1, 2, or 3 belong to. Do they belong in A, do they belong in B, or do they belong in neither of these? Or you can get given a series of shapes and you need to predict the next sequence, if that makes sense. So relatively straightforward, but there's a 600 questions UCAT book that you can buy from Amazon for pretty cheap, and it has a really good section on abstract reasoning, and you can go through all the different types of sequences you can get, and then that helps you to answer these questions really quickly under timed conditions. Finally, we have situational judgment. So you get 69 questions to do in 26 minutes. Again, you might be a little bit strained for time, but the more you practice situational judgment, and if you read over some medical ethics, which you might even use for your medical school interviews, it's really easy to get the marks in this section. So it helps you assess various situations, and it also asks what you would do in each situation. So there's 2 types of questions you can get. So they may give you a scenario and they'll ask you to choose the most important answer of what you would do, or they'll ask you to rank answers from the most to the least appropriate. So let's look at an example of this. So you're a 3rd-year medical student shadowing a doctor on the wards. They ask you to go and take a history from a patient by yourself and report back whilst they go and see another patient. Midway through your history taking, the patient starts to ask questions too, as they don't fully understand why you're there and talking to them. They ask several personal questions about where you live and your family. You're unsure about how much information you're allowed to disclose without crossing the professionalism boundary. Rate the following based on how appropriate they are to the situation. So this is the first question. Would you speak to the patient openly about your life? Do you think this is a very appropriate thing to do? Appropriate but not ideal? Inappropriate but not awful? Or a very inappropriate thing to do? So what do you guys what would you guys put as your answer? Okay, a few people saying D, it's unprofessional. A very inappropriate thing to do. Okay, so lots of people saying very inappropriate things. Some people saying C's. Okay, perfect. I think you guys are along the right lines of inappropriate but not awful, or a very inappropriate thing to do. Thing with situational judgment questions is I would put a line in the middle. So between, let me get my pointer actually, it might be easier to show you guys. I'd put a line through here. So you can either have, first of all, with any of these statements, you need to decide, is it appropriate or is it inappropriate? Now, from most of your answers and from what I'm thinking as well, I would put it on the inappropriate category. So we're looking at either this answer or this answer. So I think personally, it's only if it's really, really bad and if it breaks like a massive medical, rule or a professionalism rule, that's when I'd say I'd go to the extreme and say very inappropriate thing to do. If it's slightly okay, if it's inappropriate, but it's not the end of the world, if you have made that decision, then you would put C instead of D. In this case, I agree with the people who say D, a very inappropriate thing to do, only because you shouldn't disclose any of your personal information to them. It's just very unprofessional. And the way you can sort of learn whether each of these statements are inappropriate but not awful or very inappropriate thing to do is looking at the GMC guidelines of how to be a good doctor, which you can find on the internet if you just type that in. I'll add a link to that at the end of the session if someone can remind me. And if you go through those guidelines, it will tell you, what you should do and what you shouldn't do as a good doctor. So hopefully that will be helpful. So those are the kinds of questions for situational judgment. So relatively easy. It's just difficult it's sort of a little bit hard to decide whether it should be C or D, or if it's an appropriate answer, then A or B. So just learning which way to swing in terms of your answer. But most of the time, going through lots of questions can help you decide which way to swing. Main tips for situational judgment is to practice under time conditions and flag, move on and return back to it later. Don't overthink about a question you're unsure of. So if you've got one of these questions and you're really struggling between C and D, and you've decided, okay, I'm going to go with C, it's most likely that in most statements that they give you, it's not going to be a really extreme answer. So extreme answers, I would say, a very inappropriate thing to do or a very appropriate thing to do. So in this question, it did end up being D, a very inappropriate thing to do, but most of the time it tends to be B or C. So if you're unsure, go for B or C, depending on whether you assume the statement to be appropriate or inappropriate, and then come back to it, reread the statement if you have time, and then think about whether or not you've got the right answer and go with your instinct, I'd say, because situational judgment is more common sense and what you would do on instinct. So a little bit about when should you take the UCAT. A lot of people are worried about when's the best month to do it in, what's the best time. As someone already asked me, do you do it early? It doesn't matter if you do it earlier or later. So there's a few factors to consider. If you're only taking the UCAT and you're not taking the BMAT, take it anytime between August to October and when you feel you're ready. Preferably, I would advise you guys to take it August or early September, so you have more time to make your university choices based on the score that you get. Because if you leave it all the way to the 29th of September, then if you get a really good score, that's fine. But if you don't get the score that you wanted to get into the university you want to go to, then you might have to change some of your university choices last minute, which can panic you a little bit. So August or early September is when I'd advise you guys to take the test. But then again, if you feel like you need all the time, then feel free to take it on the last test day. Again, it's completely up to you, and it's up to your learning style and how much time you feel you need to study for the UCAT. But if you are also planning on taking the BMAT, you do need to remember that the BMAT is usually on a set date on the first week of November. Usually I think it's on the first Wednesday or the Thursday of November. And just to give you more time to revise for the BMAT, because BMAT is obviously includes your biology, chemistry, physics and maths content, where you actually have to sit down and properly revise some GCSE content and some of your A-level content. To give you time to do that, I would recommend you take the UCAT earlier. So end of July, month of August, something like that. And then all of September and October, you can spend your time revising for the BMAT. And you also have to remember that September, October, you would have started your final year of school already. So you'll be focusing on your A-levels and other things. So just account for that and make sure that you need to have enough time to be able to study for these exams as well. Okay, So hopefully that was helpful. These are some useful resources. So the official UCAT website is where you can book your UCAT test on. Lots of your, FAQs will be on there as well. And if you need any help regarding, how to book your UCAT test and everything, or some past papers, all of that will be on the UCAT website. There's also lots of 6med UCAT resources that you can, buy, or there's some free ones as well available. And then there's this document which just tells you all of the things that you need to know about UCAT, which is things I've covered in this session as well. So that was the end of this session. So on a scale of 1 to 4, how confident are you guys now for revising for the UCAT? Perfect. So most people said 3s or 4s was just good. Do we start now? Kieran, what are you referring to? UCAT revision. It's up to you really. I think a UCAT revision approximately takes about 2 months, like 6 to 8 weeks probably. I would say during your summer, just start revising those questions. So I'd say June onwards. And then if you want to take the exam in July, I'd say start revising early June. If you want to take it in August, you can start end of June, beginning of July. So it really is up to you. And obviously different people will need different lengths of time to revise. So yeah, it depends on you as an individual and how much time you feel you need. I booked my exam the last week of August, and I was revising from the last week of July, so exactly 1 month. So it is really depends on you and how much time you feel you need. Okay, so that was the end of the session. If you guys have any questions, feel free to ask them. I can already see there are a few questions on the Q&A, so I'll start answering them. And then if anybody else has any other questions, whether it's UCAT related or just general medicine related, feel free to ask me. Okay. Someone's asked, how do I find out about testing centres if I don't live in the UK? Do they show up on the UCAT website once I sign up? That's a very good question. I think for you guys, you do it as online, or there might be some test centres near you as well for international students. So I think definitely double check that on the website. Where can we find free practice questions? So there's free practice questions in the UCAT website itself. And there's also lots of websites. If you just type it in on Google, you will find lots of practice questions for free. But if you want to do it under timed conditions and track your scoring and things like that, if you want to pay for a subscription, get lots of questions and be able to check how well you're doing over a period of time, then you can do that as well. Someone's asked, where can I find this recorded lecture on the 6med site, or will it be emailed to us? So I'm not sure where the recorded lectures go to, so that will be something for a 6med admin person to ask. So on your WhatsApp group chats, there's a few admin people, so Barbara and Max, so you can ask those two where those recordings will be. I'm not sure if they'll be emailed to you because I'm not involved in that side of things, but it's definitely worth asking them on the WhatsApp group chat about that. Okay. Would this count as one question or 5 separate ones? So for the person who asked that question, okay, so I think you're talking about one of the previous questions I meant to. Would this count as one question? So that would be one question for the decision making. All of that, you would score, 2 marks for that. So if you get 4 out of 5 or 5 out of 5 right, then you would get the 2 marks. If you get 3 out of 5, then you'd only get 1 mark. And if you get less than that, you would get no marks. So decision making is quite difficult to score highly on. That's why as well for those kind of questions. So being really careful about the way you read statements is important. Any abstract reasoning tips? Online, there's loads of questions where they teach you the most common sequences that they use in these abstract reasoning exams. So going through those sequences and then learning to identify those sequences and patterns in a fast time, and like timing yourself, recognizing those sequences can help you answer those questions. Okay, which UCAT book were you referring to? So it's the 600 UCAT questions. Let me see if I can type that onto the chat for everyone else actually. "600 UCAT questions," that's the book I'm referring to. Might have changed recently, so definitely have a look at Amazon of the most recent book of that. What guideline were you referring to during the SJT section? Oh yeah, thanks for reminding me. I shall put that on the group chat as well. So GMC guidelines for a good doctor. And that's the one there. It's a very short document that all of you can read, and those guidelines come in handy when you come to do your medical school interviews as well. Would you say BMAT or UCAT is harder? That's a difficult question for me to answer because I didn't do the BMAT. I would say UCAT is difficult because it's aptitude questions. So it's really about, it's more like brain training. So training your brain to answer questions of that sort. BMAT is actually, I would suspect it's easier because it's content you already know. It's biology, chemistry, maths, physics, and an essay at the end that you need to do. And it's things that you've done in school. And it's just, you know, practicing past papers, which will be very, very similar to your GCSE exams. So I think BMAT would be easier. And, but at the same time, because it's specific content, you do need to memorize a lot more and learn a lot more, whereas with UCAT, it's more about thinking on the spot. So it really is, you know, depending on where your strengths lie. What range of scores is considered a good score overall? So it's the ones I talked about on average. So I think I'd say 620 per section is good. So it's considered, you know, normal to get that mark and a good average to get that mark. There are lots of statistics you can find online, but I wouldn't drill down into them too much. Just try your best in terms of how you can answer all of these questions. Okay. Someone said, how should I tackle speed? I always seem to run out of time doing timed quizzes. Okay, yeah, that makes sense. I think it's learning to, for verbal reasoning, remembering to scan the passage looking for keywords. Again, there's nothing else you can do other than practicing lots and lots of questions. If you always seem to run out of time doing timed quizzes, maybe focus on your technique. So for quantitative reasoning, you could practice more mental maths to try and get you up to speed in terms of how you answer the questions. And same with abstract reasoning, learning to recognize sequences faster. Again, it just comes with practice. There's nothing else really. What if you've revised for a long time for the UCAT and done a lot of revision but still aren't improving your scores? You need to learn which aspect for each section, what is it that, which sections you're really, really low on. And then for those sections, is there a common problem that keeps happening again and again? Is it that you're not scanning the passage correctly and therefore you're not answering the questions correctly? Is it your interpretation of the questions is wrong? Is it that you're not understanding what the question is asking of you? So trying to find out what is a common theme that's happening with the questions that you're answering, because that's what's causing you not to improve your scores essentially. And if you're really, really struggling, you know, you can, SIXMed obviously offers the UCAT and BMAT support. You can try and get a one-to-one lessons with the tutor to help you go through questions and learn how to tackle them as well. And then obviously try using different resources, because different resources may give you different tips and tricks. Is there any difference between the UCAT and the UCAT ANZ? I'm not too sure what the UCAT ANZ is. So I think it might be worth looking online or asking maybe one of the admin people about that. So I'm sorry, I'm not too sure. I won't be able to answer your question very well. So I think definitely worth looking it up online or asking someone about it. Someone else other than me who might be able to help you more. Okay. Someone's asked, what if you write it? Okay, answer that question. How do we join the WhatsApp group chat? So you should be given a link to the WhatsApp group chat. I don't know if someone else who's on the group chat will be able to send it on the chat here, the link to join. If anybody can do that, that would be great. If not, I think contacting the SIXMed people via email and asking them to help you join will be good as well. Okay. Anyone else have any other questions, UCAT related or just in general medical school related? It could be about personal statements or work experience or anything really. If you're worried about anything, feel free to ask them. I'm going to be on here for another 5-6 minutes or so, so feel free to ask any questions you want to. And I'll stop sharing as well. Okay. If not, yeah, definitely feel free to leave and go and enjoy the rest of your day. Oh, a few questions. Hi, I've just joined. I'm struggling most with the verbal reasoning section. Any tips for that and best ways to prepare? So as I was saying, for the verbal reasoning section earlier on, you might have missed that. Don't read the entire passage first. I would say read the question first and pick out keywords within the text, and then try and find those keywords within the text to make your interpretations of the statement and then answer the question. Best ways to prepare: do all your questions under timed conditions. Keep that the same all the time. Don't try and do them under your own time, because you do have a limited amount of seconds per question. And I'd say practice lots using lots of online resources, and also the 600 UCAT questions book, which you might have heard of as well. Hopefully that helps. Is medical school super competitive? I would say yes, it is. It depends on the medical school as well and how much weighting they put on different things. So if they value your personal statement and your academic achievements more, and you've done really well in that, then you're more likely to get an interview offer from them, And if they put more weighting in terms of what you scored in your UCAT or your BMAT compared to the rest of the things in your application, they might, and if you did well in that section, they're more likely to give you an interview based on that. So it's university dependent as well. But in general, lots of people do apply for medical school. So having sort of a well-balanced medical school application is really important. Advice on personal statements if I don't have work experience. If you don't have work experience, that's absolutely fine. There's lots of online work experiences you can do, like the Brighton and Sussex Medical School virtual work experience. There's also an online GP work experience you can do. If you don't have any medical work experience, that's fine. If you have non-medical work experience, or if you have a part-time job, you can still talk about those skills because they're transferable to medicine. How tough are admissions for international students generally to UK medicine? I think there is a certain number of international places for each medical school, so it can be competitive, but just having a well-balanced application and making sure that you're prepped for UCAT, BMAT and possibly interviews as well will help you with everything. Any other questions, feel free to ask them. I'll stay on for a few more minutes until we close up on the session. If not, feel free to leave as well if you don't have any questions. Any other questions at all? Oh. Would it be beneficial to talk about any research essays done as part of your curriculum? Yeah. If you're able to, if you've played a big part in that research, or if you've learned a lot from it and you're able to talk about it confidently and discuss whatever research you've done, it's important. You can add it to your personal statement, and you can also talk about it in your interview. That's absolutely fine. 3 more minutes to ask any final questions that you may have. Oh, someone said, how can you use UCAT Ninja to revise for the UCAT? I think that's an online website, isn't it? I think, first of all, when you first start revising for the UCAT, maybe looking at the sections separately, still doing the questions under time conditions, but looking at, just say, okay, today I'll spend 1 hour just looking at verbal reasoning stuff, and maybe going through questions specifically for that, and then looking through the feedback of any questions you might not have got right, and then trying to redo those same questions, and you know, 1 week later, and seeing if you do better in that. So that's how I sort of do it. So you make sure that you're constantly making progress and there's a learning curve, and that's how you get better at aptitude tests, basically. And I think with some web, I'm not sure about UCAT Ninja, but I know some websites you can have, you have sort of a tracker which tracks how well you've done for each section. So then you can know which section you're not doing too well in. So then you can focus or spend more time on those sections to bring your score up. Final minute, any questions? Okay guys, I'll end the session there then. Thanks for attending, and hopefully you'll feel a bit more confident revising for the UCAT as well. And I'll see you in maybe a future session probably. But have a good rest of the day. Right, bye.